Hi there, my name is Dr. Katrina Cox. I'm a naturopathic doctor and the author of The Opportunity in Cancer. For this January, I'd like to talk about mental health because it is Mental Health Awareness Month and its relationship to cancer recovery and cancer survivors. This topic of mental health is a huge conversation, but there are three major things that I work with patients, such as yourselves, to help gear and understand where your mental health is. The first one is understanding roadblocks. Are there roadblocks in the way of recovering your mental health? And they can be things that are physical, like nutrient deficiencies, or lingering symptoms like lack of sleep. They can be attributed to maintenance therapies. There are a lot of women that go through menopause after breast cancer, for example, or when they're on tamoxifen or letrozole or one of those types of medications, and that can affect their mental health drastically. Or the third thing is simply patients who've been diagnosed and through treatment can be in burnout. They can be absolutely burned out by the number of treatments, appointments that they've had to be to, treatments, and the recovering and the symptoms that they're experiencing. And so these types of roadblocks are very important to address, understand how they're impacting us, and that way we can actually understand how they're contributing to some of these mental health challenges, such as depression and anxiety. The second thing that I work with patients on is understanding where the neurotransmitters are being made in the body, understanding how to heal the rest of the physical body and how that can contribute to better mental health. Physical activity, for example, is one of those things. Just moving our bodies up to 30 minutes a day. And that's just going for a walk, spending time outside. Maybe it's a class, maybe it's going swimming, whatever is that makes your fancy and feel good with moving your body can contribute to reducing anxiety, for example, by 30%. Now, if we don't have enough energy and our mental health is in this, in the way, or our burnout's in the way, that can be a complicating factor. So addressing and putting together a self-care plan that includes small, different minor changes with somebody can be super, super helpful as our number 2 place. The third thing that I recognize patients that need to look at is that they really need to create boundaries. What does their life look like? How do they create enough rest? How do they sit with their emotions? How do they deal with patients or a support network that's around them? A lot of times when they are going through cancer after a diagnosis or the actual treatment, a lot of people will say, "How can I help you?" They'll show up, they will bring food, they'll sit around, but then once you're in cancer remission, they'll either disappear or they won't know what to do. So communicating with that support network and understanding whether you need time by yourself, whether you need distraction, whether you just need a camaraderie, someone to hold your hand or space, that's really important. So identifying the people in our lives that could be really beneficial in helping us to move forward and reaching out and making sure that those are the people that we're connecting with. So that a lot of patients in cancer recovery don't even recognize that they're in depression and anxiety. The first thing that I usually talk to patients about is understanding what roadblocks could be in the way of recovering or what could be contributing to their mental health decline. And things like lack of energy, for example, and nutrient deficiencies that could be contributing to that lack of energy, and where that could be a part of patients' difficulty in understanding or addressing mental health like anxiety and depression. The second thing within that group of roadblocks could be physical symptoms. Do we have lingering issues with digestion? This is a place where most of our neurotransmitters are made, and that can make it so that our brain is really struggling to deal with thoughts that can contribute to anxiety and depression. And the third thing is recognizing that a lot of cancer survivors can go through burnout, and that burnout can simply be because of treatment. It can be because of the number of appointments that they've been in. Burnout can be contributed to because of maintenance therapies, such as hormonal interventions for breast cancer patients that can be contributing to our lower levels of depression. So recognizing, the roadblocks that are in the way of our mental health recovery and how to address those is very, very important. The second thing that I work with cancer patients to understand their depression and anxiety or their mental health challenges is understanding any other physical symptoms that could be contributing. So, for example, neuropathy can contribute to a lack of ability to physically move our body and feel confident in that. Physical movement or body movement can reduce anxiety by 30%. The key is finding a way to start. Sometimes patients can really struggle with this because of the roadblocks that we previously talked about or because of those lingering symptoms. The second component to the difficulties with lingering symptoms are our GI tract. We talked about this a little bit in the first section, but when our GI tract isn't working properly, we're not creating those neurotransmitters that we really need in order to balance our mental health. So recognizing in the second component, what are the things that could be contributing with lingering symptoms that could be actually disguising our depression and anxiety. The third thing that I work with patients on is discovering a support network. What is it that we truly need? Creating a life and a lifestyle that allows us the time, the ability, the connection that allows for that self-care to addressing these concerns of depression and anxiety. That can sometimes mean having people around, and sometimes it can mean spending time by ourselves. A lot of patients will comment, such as yourselves, will comment to me about how there's a lot of people that when they're going through treatment, they can be present in their lives. So they show up, they try to help them care for their children, they try to help them care for themselves by bringing food. But once they're in cancer or a cancer remission state, those people can sometimes disappear. And that can be a really big challenge. We may not want them all around. We may want parts of that around, but communicating those boundaries, finding those people that we can connect with will help us develop that strategy of recognizing our depression and anxiety and not going through this in isolation.